always wanted to fit in. I wanted to belong somewhere because I always felt misplaced.
In her younger years, Tatiana Green was raised in Massapequa with her younger brother and single mother, and had shown great promise as a talented and gifted student.
Very intelligent, always did well in school, but I couldn't build great connections with people. I was a singer, I was gifted in drama and acting, but I could never really see my value or my self-worth.
She was happy as an elementary school student, outgoing and making friends, but she hid how she suffered inside. Hurting from a father who went to prison when she was 4 years old, there was also abuse in her home, and it caused some emotional issues that required medical attention.
I had abandonment issues, and my mother did the best that she could. She took care of us, but she was a single mom raising 2 kids and then remarried and had 2 more kids, my little brothers. So from a young age, I didn't really learn how to deal with my emotions, and I had trauma that had gone on. So when I got into middle school and high school, surprise, surprise, the world is a crazy place, and your whole life people are going to be mean, people are going to say things that hurt your feelings, but you have to learn how to put a shield, and I never learned that shield, so I personalized and I made those things true.
That approach worked against her. By the age of 13, the emotional trauma took its toll and she sought an escape. She turned to her mother's prescription painkillers to mask the emotional pain.
I, was home and my mom had surgery and she had some prescription drugs in the cabinet. I took them. I would sneak the alcohol out of the cabinet, and I used it to cope with my emotions, and then it progressed from there. When I was 17, I got prescribed oxycodone for a medical condition, and then from then on it just progressively got worse over time. And then when I was about 18, I started shooting heroin.
Unknowingly, Tatiana Green became addicted to drugs.
But I didn't believe I was an addict. I was told by other people, you're addicted, you're an addict, but I didn't really understand what that exactly meant.
It meant that without help, her life would spiral out of control. Her addiction led to a life of crime, incarceration, and homelessness. Those who cared for her feared for her safety, not knowing if she was dead or alive.
They would wait for the phone call. Is she dead? I was living in the street, and I know that if I'm able to do it, that there's other people that are out there that can, and it's very, very serious.
At the age of 21, she realized that she was an addict and sought assistance for her recovery.
One day I ran out and I went to the hospital. I asked them for morphine because I was in pain. They gave it to me and all of my withdrawal symptoms went away. And that's when I knew that I was physically dependent on drugs. People had tried to help me before. From the age of 13, I was in several psychiatric units. I was in and out of jail. I was in rehabs. I was mandated to rehab, and every time I would just walk in, sit there. I wouldn't hear a word that anybody said. I would just meet new drug dealers. I just didn't retain what was actually happening. I didn't get it. But when I finally knew that I was an addict, that's when I sought out help myself. So I had called a couple of family members and I said, please, I need to go to rehab. And I did get on a plane and I went to South Florida and I went to rehab, and I've been clean and sober ever since. What I'm doing is exactly what I'm saying to you right now, on the phone helping people.
Today, she works with several organizations, including the Long Island Council on Alcoholism and Drug Dependence. She's also helping others through her own project, Onward Forever.
Tatiana is a young person who's in recovery, and she does a lot of speaking out about this disease, how it affected her, and how people can get help, where people can get help, and that it's important to realize that there's no shame in this disease, that there is treatment and there is recovery.
About 1,132 last month call first, and then they're invited in for support groups, they're invited in for assessments, and they're made referrals. Tatiana's kind of been in the constellation of the agency for the last 3 to 5 years. She's been willing to do some media as a young person in recovery to really get the message out there. She's been a great support to the agency as we've been to her.
I started working in the field when I had about 2 years clean and sober. I went back to school. I decided it was my passion to help other addicts and alcoholics, and I did that. I interned for a little while, and then I worked for an organization, and then I worked for another organization helping people get into rehab, and LICADD is a really great source for the community. Thousands of people touch these rooms and get help from clinicians in here that need outpatient treatment, inpatient treatment, rehab.
For more on Tatiana Green and her mission to save lives for those addicted to drugs, go to onwardforever.com. When Push Pause returns, LICADD saves lives with a simple phone call.
Thank you for calling Long Island Council on Alcoholism and Drug Dependence, Open Arms EAP. How may I help you? Thank you for calling Long Island Council on Alcoholism and Drug Dependence, Open Arms EAP. How may I help you?
In 2015, Long Island Council on Alcoholism and Drug Dependence, LICADD staff, fielded over 10,000 calls from help from people seeking advocacy, counseling, support groups, interventions, and access to treatment.
What I would like to do is just get some more information in terms of now the amounts of using, what kind of substances you might be using at this point. On a regular basis, we have people calling on what we call a crisis basis, where they're looking for immediate help. Sometimes, even just going through withdrawals, whether it be, mental symptoms, whether it be physical. Sometimes they're actually motivated to go into treatment at that point.
A couple of years ago, we were seeing 300-400 calls a month, which is still a lot, and now we're up to over 1,000 a month. Just people calling, looking for resources.
Hi, Long Island Council on Alcohol and Drug Dependence and Open Arms EAP. Mary speaking. May I help you? When our phone calls come in, we refer clients for treatment, or if they want inpatient, outpatient, whatever their needs are. And because our population that we serve is so different and diverse, as is our, resources that we provide them with.
The nonprofit agency provides life-saving alcohol and drug prevention intervention services to at-risk children, individuals, and families on Long Island struggling with the effects of addiction. The numbers are staggering. Steve Chasman is also a clinical social worker who is well-versed in the treatment of substance use disorders.
CDC reports since 1999, prescription drug overdoses, including opiate overdoses, have quadrupled in the last, as it is, 15 years. That's staggering. Over 30,000 Americans lost their lives to overdose last year alone. We're losing more than 350 a year right here in Nassau and Suffolk. And unfortunately, on Long Island in New York State, we have the sad statistic of the most number of fatal overdoses was in Suffolk County. So when you talk about standing in the epicenter of the crisis in New York State, Suffolk County is it.
As the 24-hour hotline provides screenings and referrals for those seeking assistance, Long Island is faced with an opioid epidemic of historic proportions. Opioids are most often used by prescription to relieve pain. In 2015, an estimated 43% of individuals who overdosed on heroin are addicted to opioids. LICADD Director Steve Chasman is a clinical social worker that's well-versed in the treatment of substance-related disorders.
I think it needs to be known that substance use disorders is a psychological or a psychiatric diagnosis. So the person running down the street at 4 in the morning in their Long Island community to sell stolen laptop computers for more heroin is not in his or her right state of mind. I think they're in a heightened state of denial, in the throes of an obsession and compulsion. Obsessions are recycled thoughts. I need another. I need another. And they feed compulsions, which are repeated behaviors, whether take another, take another. There is this mentality across the nation, and you'll find no shortage of prescribers willing to prescribe a whole host of medications to enhance the human experience for one reason or another. But that whole better living through chemistry mentality has really contributed to what is the greatest public health crisis we've seen around substance use and prescription medication in this country, which unfortunately has taken the human toll of so many Long Islanders, New Yorkers, and Americans at a rate we've never before seen.
Recent arrests may suggest that law enforcement on Long Island are taking steps in the fight against drugs.
And this gets twisted on the top like this.
LICADD is also training law enforcement and ordinary citizens on how to use a Narcan device that helps reverse the effects of an overdose and save a person's life.
We work very closely with both county executives, Executive Mangano and Executive Bellone. We work with both county police forces in conjunction. Now, as a not-for-profit community-based organization, we are not here to help the police do their job, other than we support the police in doing what they can. We need to work with people who struggle with substance use disorders, people that are afforded treatment. We need to support them in their road to recovery, and if there are setbacks or relapses, re-engage them and help them along. Again, people with substance use disorders, not bad people that we're trying to get good. Sick people, and like all sick people, LICADD believes that everyone has a right to get well.
I would certainly like it if you came now. As soon as you can, I'll be waiting on you, okay? And we'll have a talk.
If you or someone you know suffers from substance abuse, call the Long Island Council on Alcoholism and Drug Dependence 24-hour hotline at 979-1700 or go to LICADD.org. For Push Pause in Mineola, this is Archie Snowden.